Welcome, everyone. I am Dr. Maria Morrison. I'm an audiologist and tinnitus specialist. And so today we're going to be talking a little bit about tinnitus and how Lenire can help. So just a little bit about me. I am a lover of Disney. It is the most magical place on earth. I have family that live in Orlando and work for Disney, so it makes it really easy for me to visit. But when I graduated back in 2003, it did not take me long to realize that I really was not prepared to help tinnitus patients. I really did not get a lot of training or education when it came to tinnitus in graduate school. So of course I went in search of training. I have been helping tinnitus patients since 2007. I had taken a week-long course in tinnitus retraining therapy out in Maryland. Since then, I'm trained in progressive tinnitus management, which was developed by the VA, tinnitus activities treatment, and taking courses from the Tinnitus Practitioners Association. And of course, most recently was my training with Lenire. That was last year. I myself have tinnitus. I never noticed tinnitus until I was learning how to treat it. So go figure that one out. It was during my week-long course for TRT back in 2007. It was a Wednesday. It was right after lunch. I distinctly remember hearing a sound in my ears, and it kind of sounds like bacon frying in a pan. So that is what I hear, and I very much understand what my patients are going through. So if you don't already know what tinnitus is, it occurs when someone hears a sound in their ears or their head, but it's not coming from their environment, right? There's no external source. It can manifest as a ringing, buzzing, hissing, or other noises. Again, mine sounds like bacon frying in a pan, like a sizzling. Tinnitus can be temporary or chronic, and the intensity can vary wildly. There are two types of tinnitus. So there's subjective and objective tinnitus. Subjective tinnitus is the most common. It's the one that I have. It's when only the patient can hear the sound. But there is objective tinnitus, which actually can be heard by others, and that type is very rare. So what if I told you, and please keep an open mind, that tinnitus isn't the problem? The problem is how we react to the tinnitus. And I completely understand if maybe your initial reaction is to push back from that statement, but I want you to think about it. Tinnitus or tinnitus is a sound, and we are surrounded by sounds all day. Your refrigerator fan in the kitchen, it kicks on and kicks off, it makes a noise, but we don't have our morning cup of coffee and think, ugh, how am I going to get anything done with that noise going on and off all day, right? We don't react to the sound of the refrigerator because our brain has filtered it out. Our brain has decided that that sound is not important. It's very similar for folks that live near airports or train tracks. At first, when they move there, the sound of the planes or trains can be very bothersome. But after about 6 months, they don't even notice those noises anymore. Why? Because their brain has filtered it out. The brain has decided that those sounds are not important and can be ignored. We just need to train your brain to do the same thing with tinnitus, and Lenire can help. So what is Lenire? Lenire is an FDA-approved tinnitus management system, and it's comprised of 3 parts: the tongue tip, the headphones, and the controller. It is these 3 parts that allow Lenire to provide bimodal neuromodulation. So this means we're going to stimulate your brain in 2 ways, through sound and through touch. This activates neural pathways involved in auditory processing. It is this combination which makes Lenire so successful. It's 2 inputs working together to change the way your brain reacts to tinnitus. This bimodal neuromodulation is what allows us to drive change differently, more quickly than other treatments. We're stimulating 2 parts of your brain, creating a stronger and more effective neuroplastic response. And here's why that matters. So unlike sound-only therapies, Lenire combines precisely timed sound stimulation with mild electrical stimulation on the tongue. So what you're hearing and what's being stimulated on your tongue, it is timed in a specific way. This dual input encourages the brain to rewire itself more effectively, reducing tinnitus perception faster. Tinnitus is believed to be the result of maladaptive changes in the brain's auditory pathways. By stimulating both the auditory and the somatosensory systems, Lenire helps correct these changes more effectively than sound therapy alone. And then, of course, Lenire's clinical trials show significant improvement in tinnitus symptoms within the first 6 to 12 weeks, whereas traditional sound therapies often take much longer. Now, keep in mind, the goal of Lenire is to not make tinnitus disappear. There's no way to do that. However, we can help the brain to adapt and reduce its focus on tinnitus, like myself. I have tinnitus, but I don't even notice it's there unless I'm listening for it. So we're going to watch a short video on how Lenire works. Oops, sorry. Let's start.
Lenire by Neuromod Devices uses dual-mode stimulation to soothe tinnitus. But what exactly is tinnitus, and how does dual-mode stimulation treat it? Let's start with the brain and how it responds to stimulus. Repeated exposure to sensory inputs such as sight, sound, and touch strengthens or opens new brain connections. These connections are also known as neural pathways. As this occurs, other neural pathways can become weaker. These changes are known as neuroplasticity and are essential for learning and development. Playing the piano is an example of positive neuroplasticity. At first, playing the piano can be difficult. Regular practice repeatedly exposes the brain to sound, hand movement, and visual sensory inputs. This reinforces piano playing pathways and can lead to better playing over time. Tinnitus, commonly known as ringing in the ears, can be a result of negative neuroplasticity. Hearing loss can cause the brain to compensate for a loss in a sensory input. The brain then creates a new sound pathway to replace the loss of sound, even when there is no external source. This is otherwise known as tinnitus. Many people with tinnitus will try sound masking to get relief. Sound alone can activate pathways to temporarily distract from tinnitus. However, adding a second sensory input keeps the pathways active for longer and in a stronger manner. Lenire's dual-mode stimulation combines two sensory inputs, sound stimulation and multi-pattern tongue pulses, to activate hearing and sensory pathways. This dual-mode approach weakens tinnitus pathways and helps the brain to stop focusing on tinnitus sounds. Tinnitus will still be present, but the brain will become less sensitive to it, which can dramatically reduce the impact tinnitus has on a person's overall quality of life. Learn more about the Neuromod's scientifically proven tinnitus treatment device, Lenire, by visiting www.lenire.com. Lenire. Soothe tinnitus.
All right, so after watching that video, you may be wondering, well, who's a good candidate for Lenire? So Lenire was designed for adults with chronic subjective tinnitus for over 3 months. So if your tinnitus recently came on in the last week or two, Lenire may not be the best option for you. Lenire is best suited for those with hearing in specific ranges. Ideally, at least 25% of your hearing thresholds are up to 40 decibels in the low frequencies and 80 decibels in the high frequencies. Now, if your hearing loss is more severe, it's not to worry. Lenire is still an option for you, but it's important to understand realistic expectations. It might take you a little longer than 12 weeks to see those results. And then, of course, we're going to assess the impact of tinnitus on your daily life through the Tinnitus Handicap Inventory, the THI. This is a standard clinical tool used for many years in tinnitus clinics to help determine how tinnitus affects your day-to-day life. The THI will help us to determine if Lenire will provide noticeable benefits. So, for example, if you score low on the THI, this may indicate that tinnitus is not very impactful in your day-to-day life, and therefore Lenire may not provide noticeable benefits. Not to worry, there's other management strategies that can help. The idea is to ensure the treatment is aligning with your specific needs and maximizes potential outcomes. So, of course, our comprehensive evaluation ensures we consider all aspects of your hearing and the impact tinnitus is having on your life so that we can tailor recommendations to your unique situation. So now, who's not a good candidate? So Lenire is not recommended if you have objective tinnitus. Again, that's that rare type of tinnitus in which other people can hear the sound that you hear in your head. Other contraindications include those with sharp or shocking pain in the head or neck, those with active medical implants like pacemakers or defibrillators. In addition, those with epilepsy or other seizure disorders are not good candidates. Of course, the health of your tongue and oral cavity are also taken into consideration because ulcers or infections on your tongue can reduce the effectiveness of the device's stimulation. And finally, pregnant women are not great candidates for Lenire. Now, if you have any of these contraindications listed, it doesn't automatically exclude you from using Lenire. In all of these cases, we provide and encourage a thorough risk-benefit evaluation with medical approval from your doctors to ensure that safety remains the top priority. Now, what does treatment look like? Maybe you decide, yes, I want to go for Lenire. What is it going to mean to you? So when you are a Lenire user, you're expected to do 2 30-minute sessions each day. So typically 30 minutes in the morning and then again around dinner time or just before bed. More does not equal better. So we don't want you doing Lenire more than an hour a day. You're going to do these sessions for a minimum of 12 weeks. And these sessions should be done in a quiet environment where you can relax. You shouldn't be doing your sessions while doing the dishes or going for a walk. We want you to be seated comfortably, and we don't want you watching TV or listening to the radio. Most of my patients do crossword puzzles or read a relaxing book. Once fitted with Lenire, you're going to visit me at least twice. You will come to me after using Lenire for 6 weeks, and then again in another 6 weeks at the 12-week mark. Now let's talk realistic expectations. Tinnitus won't disappear overnight. Most patients start noticing improvements after a few weeks of consistent use. Significant reduction in tinnitus-related distress typically occurs within 6 to 12 weeks. Lenire does not cure tinnitus. It helps the brain rewire itself to make tinnitus less noticeable and bothersome. Some patients experience a dramatic reduction in tinnitus perception, while others will notice it's still present but less distracting. And not everybody responds the same way. Clinical trials show about 80% of patients benefit, but the level of improvement varies. Factors like tinnitus severity, duration, and overall brain plasticity can influence the outcomes. And of course, skipping sessions will slow your progress. Lenire must be used consistently for at least 12 weeks. Following up with your provider ensures that the device is optimized for you. Some patients may notice temporary spikes in their tinnitus. This is normal and can be a sign that the brain is adapting. Over time, most patients experience a steady decline in tinnitus perception. And finally, Lenire isn't a standalone fix for all tinnitus patients. Patients often see the best results when pairing Lenire with stress management techniques, good sleep hygiene, and avoiding excessive caffeine, alcohol, or loud noise exposure. So what can you do to ensure you are successful with Lenire? Well, I tell patients to schedule time for Lenire treatments. Add them to your calendar so that they get done and create a routine with it. Again, most of my patients do Lenire as part of their wake-up routine and their bedtime routine. Lenire treatments should be considered quiet me time. You should not be doing Lenire sessions when you're driving, riding a bike, or doing the laundry. You should be in a quiet, calm room, avoiding screens and relaxing. And what's really nice is that their controller has a built-in timer. So it's going to turn off after 30 minutes of use, so you don't even need to worry about the time. Now, you might be wondering, well, how is it that they're successful? Or how many people have actually used it and been successful? Now, if you go to the Lenire website, they have lots of studies to show how effective their product is. However, I wanted to show information from an audiologist that works at a private practice who I know and trust. Her study actually matches or beats the data from Lenire's own studies. Her studies included a total of 220 patients. 96% of them actually finished the full 12 weeks of treatment, so 4% didn't finish the full 12 weeks. In her clinical trial, it shows that 91% of patients experience meaningful benefits with Lenire. This is huge, you guys. Tinnitus retraining therapy used to be considered the gold standard for tinnitus management, and that took an average of 12 to 18 months. Patients are seeing similar results in as little as 12 weeks. Now, perhaps you currently wear hearing aids and you're wondering, can Lenire still be effective for you? And the answer is yes. 92% of hearing aid users benefit from using Lenire to treat their tinnitus. So, is Lenire effective? Yes. Lenire has shown to be effective in reducing the impact of tinnitus in as little as 3 months, and it is very safe to use. So we've talked a lot about Lenire. I want to just switch gears and talk a little bit about my office specifically. We do a detailed assessment, and this assessment reflects our commitment to personalized care because no two tinnitus patients are the same. Everybody is impacted a little bit differently. Everybody's sounds that they hear in their head is a little different. I want to balance your overall health and your tinnitus needs while exploring potential treatment possibilities. When doing a Lenire evaluation, I take the time to ensure that you are fully informed about what you can achieve with Lenire. By discussing this openly at your assessment, I empower you to make a confident, well-informed decision about your care. I want to ensure that you are well educated on all your tinnitus options so that you make the right decision for yourself. All right, so if you are interested in Lenire, I encourage you to make an appointment. The first step is a comprehensive tinnitus assessment. This is where we're going to evaluate your tinnitus, the impact it's having on your life, which is going to help me to determine if Lenire is right for you. And if it's not, I can guide you to other solutions. Lenire is one aspect. The management of tinnitus is not about a single device. It's more about finding the right combination of tools and strategies for you. So if you're interested, please schedule your appointment today.